I am Dr. P.C. Mondal, interventional cardiologist and head of the department Apollo Gynecological Hospital, Kolkata, and also the director of cardiology, Apollo Heart Institute, Kolkata. There is a very fine boundary between syncope and cardiac arrest. Arrest means sudden cardiac death. In syncope, there is a transient loss of consciousness and patient will regain consciousness within few seconds. Whereas in sudden cardiac death, he will not or she will not recover. That means once there will be loss of consciousness and regaining of consciousness, in sudden cardiac death, there will be no regaining of consciousness. That means boundary is very fine. And regarding diagnosis, the modern technology has got a strong role because the routine investigations and patient's history, most of the time patient history is inappropriate. That means it depends on the investigation agents, known as gadgets of investigations, is the main way of diagnosis. It has got some age-wise distribution. That means in younger age, syncope, unless there is some congenital or cardiac defects, most of the time syncope in young is not so fatal in compared to in middle age or old age, where most of the time some fatal causes underlie this presentation. That means a man of 70 having a syncopal attack usually have some dreaded disease inside, needs more stringent evaluation, whereas a 15 years old girl having a fainting attack, unless there is a family history of sudden cardiac death or he is having some detectable cardiac abnormality, most of the time it is related to some vasovagal that is mostly benign. If there is an Holter or remote monitoring system by loop recorder, either implantable or external loop recorder, that can be transmitted by wave, and doctor can analyze from a metro city and can diagnose from a remote area. That means suppose a patient is 200 kilometers away from Kolkata and he is having an external loop recorder, and that record, that means when he is fainting or she is fainting, he can warn that I have a fainting attack today and I have a loop recorder with me. Immediately that record can be analyzed and can be diagnosed what has happened and what is the treatment for him or her. So this newer technology has got an immense value, particularly in this COVID situation where this transportation and mixing of people is avoided. This remote monitoring has got a strong role in managing patient with syncope or fainting attack. One, all syncope needs clear-cut evaluation, because syncope means the patient, if there is in a standing position, suppose the patient is going downstairs from third floor to second floor or second floor to first floor, on the staircase he may fainted or she may fainted, there may be a fatal injury to the head, there may be a fatal injury to the other parts of the body. So that means all syncope has got a strong implications in health, and there is also some mortality. That means the patient may not recover also. From that point of view, all syncope patients needs strong evaluation and full evaluation. And the irony thing is that even after detailed evaluation, some cases needs longer follow-up period. That means 1 or 2 visits to a doctor may not be sufficient to elucidate the cause and treatment.
For more updates from CXO TV, please like and subscribe to our channel.